Hi friends, today our topic is the meningitis. So for better understanding we will split the term meningitis into meninges and the itis. So meninges plus itis. So the meninges are the protective covering of the brain and the spinal cord. Protective covering of brain and spinal cord. Spinal cord. And itis means the inflammation. So meningitis is the inflammation of the protective covering of brain and spinal cord, that are the meninges. So the meninges, there are three protective coverings of the brain, that is meninges. The first one is the dura mater. Second one is the arachnoid mater. And the third one is the pia mater or the pia mater. Now we will focus on the coverings of the brain. Firstly, at first there is a bone of a skull. Second one, there is the dura mater. Third one, there is an arachnoid mater. Between the arachnoid mater and the pia mater, there is a subarachnoid space through which the CSF passes. Then there is a pia mater and there is the brain. So this is the normal anatomy we will require over here. Now we will focus on the etiology or the causes of the meningitis. So first one is the bacterial, viral, fungal, parasital infections. So we will focus on the bacterial, which are the more important. So the bacteria enter the bloodstream and cross the blood barrier to enter the meninges. So there are also other type of bacterial invasion where the bacteria does not enter the blood directly, but it enters the meninges directly through the ear or sinus infection or the trauma. So during the trauma or the skull fracture, the bacteria directly invades the meninges. So the skull fracture, injury or the trauma. So there are also the viral causes also there, but they are less severe, and the fungi causes. The viral causes are the less severe, and the fungi causes are also the important, and they are life threatening. So we will focus on the viral causes. The first one is the mumps, herpes virus, and the fungi. There are patients with AIDS and other infections. There are also the autoimmune etiology of the meningitis. So autoimmune diseases like lupus. Due to this also the meningitis can occur. Now we will focus on the pathophysiology of the meningitis. Due to all etiological factors, the organisms such as bacteria or viruses invade the bloodstream and cross the blood-brain barrier. So after the invasion of the bacteria, there is a inflammatory response initiated. So it leads to decreased cerebral tissue blood flow and leads to altered cerebral tissue perfusion. Lastly, there is an increased intracranial pressure. So the intracranial pressure increases and it put pressure on the brain and the surrounding parts. So these are the pathophysiology of the meningitis. Now we will focus on the signs and symptoms of the meningitis. So for better remembering or to remember in a better way, we will first take as the 3H. So the first H is the headache. Second one is the hard or the stiff neck. Third one is the high temperature, that is the fever. Fourth one is the vomiting. Because of the increased intracranial pressure, there is the altered consciousness or the confusion. So then there is also the main important symptoms of the meningitis. These are the positive Brudinski and the Kernig's sign. For to better learn, I have attached the photos with it. So these are the possible signs and symptoms of the meningitis. Here now we will focus on the diagnosis part of the meningitis. The first one is the CT scan. The second one is the lumbar puncture, or also we can say as spinal tap. So if the viral infection is there, so viral means very clear CSF, and bacterial infection is there, bacteria. So there is the bad cloudy CSF can be seen, lumbar puncture. Then the chest X-ray, and there are the blood cultures. So these are the diagnosis of the meningitis. Now we will focus on the management part of the meningitis. So first one is the antibiotics. Antibiotics. The antibiotics should be start within the 30 minutes of the admission. So the broad spectrum antibiotics like cephalosporin should be given to the patient. Anticonvulsants, because there may be chances of seizures, so anticonvulsants also may be given. Analgesics and the antipyretics, because if the patient is having fever, so the antipyretics also be given. So these are the management part of the meningitis. Thank you. Hope you like.